The fluorescent lights above me hummed with that sterile persistence only hospitals possess. I stood at the edge of the emergency bay, clipboard pressed against my chest, watching the ambulance doors swing open. Cold November air rushed in, carrying with it the smell of diesel and rain. The paramedics wheeled in a stretcher, and on it lay a man whose presence commanded the room before he even spoke. His clothes were layered, 3 jackets, maybe 4, all of them stained with the history of streets I'd never walked. His beard was wild and unkempt, streaked with gray that made him look older than he probably was. His eyes, though, they were sharp, alert. They darted around the emergency room with the wariness of someone who'd learned not to trust enclosed spaces or people in uniforms. Male, approximately 50 years old, found unresponsive near the downtown transit station. The lead paramedic rattled off as they rolled him past me. Vitals stable now, but he's been complaining of severe throat pain, says he can't swallow. I followed them into Bay 4, my sneakers squeaking against the polished floor. The attending physician, Dr. Miriam Keller, was already waiting. She had that look, the one that told you she'd seen everything twice and wasn't impressed by anything anymore. Her silver hair was pulled back tight, and her reading glasses hung on a chain around her neck. "Dr. Reyes," she said without looking at me, "you're taking point on this one." My stomach tightened. Taking point. That meant primary assessment, initial workup, and presenting to her before any major decisions. It also meant I was on display, every choice scrutinized. The man on the stretcher coughed, a wet, rattling sound that made me wince. His hand flew to his throat and his face contorted in pain. "Sir," I stepped forward, keeping my voice level. "I'm Dr. Reyes. Can you tell me your name?" He looked at me through narrowed eyes, suspicious. For a moment, I thought he wouldn't answer. Then, in a voice scraped raw, he said, Marcus Webb. "Okay, Marcus, I need to ask you some questions. Can you do that for me?" He nodded, barely. "When did the pain start?" "Few days ago." He swallowed, and I could see the agony that simple motion caused. His Adam's apple bobbed, and he grimaced. Thought it was just, cold or something. Dr. Keller crossed her arms, watching, evaluating. "Can you describe the pain?" I asked. "Is it sharp, dull, burning?" "Sharp," he rasped. "Like swallowing glass. Every time." I jotted notes on my tablet. "Have you eaten anything recently?" A bitter laugh escaped him. "When you got nothing, you eat whatever you can find." That stopped me. I looked up from my screen, meeting his eyes. There was a story there, years of it, written in the lines of his face, in the defensive hunch of his shoulders. "Any difficulty breathing?" I continued. "Some. Gets worse when I lie down." Red flag. I glanced at the monitor displaying his vitals. Oxygen saturation was at 92%. Not critical, but lower than comfortable. "We're going to examine you, Marcus. Is that all right?" He shrugged, a gesture that seemed to say he'd lost the right to refuse a long time ago. I approached the bedside, Dr. Keller shadowing me. I pressed my fingers gently against his neck, feeling for lymph nodes. They were swollen, hard beneath the skin. His breath was sour, the kind that comes from days without proper hygiene, but there was something else underneath it, something metallic. "Open your mouth for me," I said, reaching for a tongue depressor and pen light. Marcus complied, and I leaned in, shining the light down his throat. What I saw made my hand pause. The back of his throat was inflamed, angry red tissue glistening with moisture, but it wasn't just inflammation. There was something else, an irregularity in the contour, a bulge that shouldn't be there. I stepped back, my mind racing through differential diagnoses. Abscess, tumor, foreign body. "Dr. Reyes?" Dr. Keller's voice cut through my thoughts. "Significant pharyngeal inflammation," I reported, keeping my voice steady. "Possible mass or obstruction. I'd like to order imaging." She nodded. "What kind?" "Lateral neck X-ray to start, then possibly a CT if needed." "Good, order it." I turned to the nurse, Sarah, who was already pulling up the order form on the computer. "Lateral neck X-ray, stat." Marcus was watching me, and when our eyes met, I saw something I hadn't expected. Hope. Small, fragile, but there. "We're going to figure this out," I told him, and I meant it. But as they wheeled him toward radiology, Dr. Keller pulled me aside. "Dr. Reyes," she said quietly, "manage your expectations. Homeless patients often present with advanced pathology. If it's a tumor, it's likely been growing untreated for months, maybe longer." Her words were clinical, practical, but they felt heavy. "I understand," I said. She studied me for a moment, then nodded. "I hope you do." I watched Marcus disappear down the corridor, and a question formed in my mind, one that would haunt me through the hours to come. What happens when the system teaches you to see a diagnosis before you see a person? I didn't have an answer yet, but I knew I was about to find one. The waiting was the hardest part. I busied myself with other patients while Marcus was in radiology, a teenage girl with a sprained ankle from basketball practice, an elderly man with chest pain that turned out to be severe heartburn, a construction worker with a nail through his hand. Each case demanded my full attention, but my mind kept drifting back to Bay 4, to the man with the ravaged throat and suspicious eyes. The teenage girl, Maya, was 15 and had twisted her ankle during a playoff game. Her parents sat beside her, concerned but not panicked, the kind of worry that comes with minor injuries. As I wrapped her ankle and explained the recovery protocol, I couldn't help but think about Marcus. Did he have people who worried about him like this? Or had those connections frayed and broken over the years? "Dr. Reyes?" Maya's mother asked, pulling me back to the present. "How long until she can play again?" 2 to 3 weeks with proper rest and physical therapy, I said, refocusing. "Ice it regularly, keep it elevated, and follow up with your primary care physician in a week." They thanked me and left, Maya hobbling on crutches but already texting her teammates. Such a small injury in the grand scheme of things, but it mattered to her. Every case mattered to someone. The elderly man, Mr. Chen, had clutched his chest and been certain he was dying. His wife had called the ambulance in a panic. After running an EKG and checking his cardiac enzymes, we determined it was gastroesophageal reflux. Painful, but not life-threatening. The relief on his wife's face when I told her was profound, tears streaming down her cheeks as she squeezed her husband's hand. 52 years married, she told me as I prescribed antacids. "I'm not ready to lose him yet." "You're not losing him today, Mrs. Chen," I assured her. These were the straightforward cases, the ones where medicine worked the way it was supposed to. Diagnose, treat, discharge, clean and simple. But even as I moved through them, part of my mind remained with Marcus, wondering what we'd find in those x-rays, dreading the possibilities. Dr. Keller found me suturing the construction worker's hand. She stood in the doorway, watching my technique with that same evaluating gaze she wore like armor. "Clean stitches," she said when I'd finished. "You've got steady hands. Thank you." The x-rays back on your homeless patient. Something in her tone made my chest tighten. "And? You should see it yourself. Meet me at the imaging station." She left before I could respond. I disposed of my gloves, gave the construction worker, a man named Rodriguez who'd been framing a house when the nail gun misfired, his aftercare instructions, and headed to the nurse's station where the imaging monitors were set up. Dr. Keller was already there, arms crossed, staring at the screen. When I saw what she was looking at, my breath caught in my throat. But I'm getting ahead of myself. Let me take you back to those moments in radiology, to what I learned later from Keisha about how Marcus had handled the procedure. The radiology suite was in the basement, a maze of corridors lit by lights that seemed dimmer than the rest of the hospital. I'd walked Marcus down myself earlier, staying with him even though I had a dozen other things demanding my attention. Something about his case had hooked into me, a feeling I couldn't shake. The wheelchair had squeaked as I pushed it through the hallways, past supply closets and equipment rooms and doorways leading to spaces I'd never explored. Marcus had been quiet during the journey, his hands gripping the armrests tightly. "You okay?" I'd asked. "Just nervous," he'd admitted. "Never been fond of these machines." "Won't take long," I'd assured him. "Just hold still." Keisha, the x-ray technician, had been waiting for us. She was young, maybe 25, with kind eyes and quick, efficient movements. She'd helped Marcus out of the wheelchair and positioned him against the imaging panel. But later, after everything, Keisha pulled me aside during a brief lull in the emergency department chaos. We stood near the vending machines, and she looked troubled. "Dr. Reyes," she said, "I need to tell you something about your patient, Marcus Webb. What happened?" "He was shaking," she said. "Not from cold, from fear. He kept asking if the machine would hurt him, if it would make things worse. If I was going to tell him to leave like other hospitals had." My chest tightened. "What did you tell him?" "The truth, that it was just pictures, that it couldn't hurt him." "But Dr. Reyes, the way he looked at me..." She paused, choosing her words carefully. It was like he expected me to lie, like he'd been lied to so many times that truth didn't even register anymore. That image stayed with me. Marcus standing against the x-ray panel, trembling, expecting betrayal because it was all he'd known. "Did he say anything else?" I asked. "Yeah. Right before the second image, he said something that broke my heart." Keisha looked down at her hands, which were clutching a coffee cup so tightly I thought it might crack. He said, "If something's wrong with me, if I'm dying, just tell me quick. Don't make me hope." What kind of life teaches you to say something like that? I didn't have an answer for her. I still don't. And there was something else, Keisha continued. When I was positioning him for the lateral view, I noticed scars on his neck. Old ones, faded but visible, like someone had, I don't know, like he'd been hurt before. What kind of scars? Linear, thin, could have been from fights, maybe. Or self-inflicted. I don't know. But they were there, and they told a story I couldn't read. I made a mental note to document that in his chart, to ask him about it when the time was right. Every scar was a chapter in a life story, and Marcus's story was clearly longer and more painful than I'd initially understood. Now, standing at the imaging station with Dr. Keller, I stared at the X-ray results and felt the world tilt slightly. There, in stark black and white against the soft tissue of Marcus's throat, was an object, elongated, narrow, unmistakable, a razor blade. Jesus, Sarah whispered behind me, having appeared without my noticing. Dr. Keller zoomed in on the image, her expression unreadable. The blade was lodged in the upper esophagus, oriented vertically, its sharp edges pressing against the tissue walls. But what made my stomach drop was the surrounding tissue. Inflamed, swollen, showing signs of infection and possibly necrosis. "How long do you think it's been there?" I asked, my voice barely above a whisper. "Based on the inflammation? Days, maybe a week." Dr. Keller pulled up additional angles of the X-ray. "See this shadowing here? That's likely abscess formation. And these striations in the tissue? That's damage from repeated swallowing, the blade cutting him over and over again." I felt sick. The thought of Marcus walking around for days, every swallow in agony, every breath carrying the metallic taste of his own blood, it was almost unbearable. "We need to get him back to the bay," I said. "Start antibiotics immediately. This could go septic." "Already ahead of you." Dr. Keller was typing orders into the system. "But first, we need to talk to him. Find out how this happened. Does it matter how?" She looked at me sharply. "Yes, Dr. Reyes, it matters. Because if this was intentional, if this was a suicide attempt, we have a completely different set of protocols to follow. Psychiatric evaluation, mandatory hold, the works. I hadn't thought of that. The possibility that Marcus had swallowed the blade on purpose, that this was a manifestation of despair so deep it sought obliteration. "Let me talk to him," I said. "Why you?" "Because he trusts me. Or at least he trusts me more than he trusts anyone else here. Doctor, Keller considered this, then nodded. "Fine, but I'm coming with you. And Dr. Reyes, be prepared for answers you might not want to hear." Marcus was back in Bay 4 when we arrived, sitting upright on the bed, his hands folded in his lap. He looked smaller somehow, diminished by the sterile environment and the machines surrounding him. When he saw us enter, his body tensed. "Marcus," I said gently, pulling up a chair beside the bed. "We got the X-ray results back." His eyes searched my face, looking for clues about what was coming. "Bad news? There's an object lodged in your throat, a razor blade." For a long moment, he didn't react. Then his hand moved to his throat, touching it as if he could feel the blade through his skin. His fingers trembled slightly, and I noticed again those old scars Keisha had mentioned. Thin white lines barely visible beneath his unkempt beard. "I know," he said quietly. "You know?" Dr. Keller's voice was sharp. "You knew there was a blade in your throat?" "Yeah." He wouldn't meet our eyes. "Felt it go down. Felt it cutting me every time I swallowed after that." "Marcus," I leaned forward, keeping my voice level. "I need you to tell me how this happened. Did you swallow it intentionally?" His head snapped up, and for a moment I saw anger flash across his face. Not at me, but at the implication. "What? No! God, no!" "Then how?" He was quiet for so long I thought he might not answer. The monitors beeped steadily in the background. Somewhere down the hall, a child was crying, the ordinary sounds of a hospital continuing its work. When Marcus finally spoke, his voice was barely audible. "I was hungry, hadn't eaten in 3 days. Found what I thought was half a sandwich in a trash can behind a gas station on 5th Street, the one near the old factory." I nodded, encouraging him to continue. "It was dark, past midnight. I wait until that time because fewer people are around to tell me to move on or threaten to call the cops. The sandwich was wrapped in foil. I didn't look at it too close, just unwrapped it and started eating." His voice cracked. "Didn't realize someone had used the foil to throw away a used razor blade. It was tucked inside. By the time I felt something sharp in my mouth, I'd already swallowed." The room fell silent except for the steady beep of the heart monitor and the distant sounds of the emergency department continuing its chaotic symphony. "Why didn't you come to the hospital immediately?" Dr. Keller asked, her voice softer now, the edge of accusation gone. Marcus laughed, a bitter, hollow sound that held no humor. "You know how many times I've been turned away from emergency rooms? How many times securities escorted me out because I was disturbing other patients or didn't have a real emergency? I once came in with a broken rib. You could see the bone pressing against my skin, and they told me to go to a free clinic. Gave me a bus token and sent me out the door. That shouldn't have happened," I said. "But it did, and it wasn't the only time." He looked at me with eyes that held decades of resignation. "So when I swallowed that blade, when I felt it cutting me, I figured, what's the point? They'll just turn me away again. Or worse, they'll stabilize me and hand me a bill that'll follow me forever. So I just dealt with it." "Marcus," I said carefully, "that blade has been cutting you from the inside for days. You could have died from infection, from perforation of your esophagus, from bleeding out internally. I know that now." He looked down at his hands, at the scars and calluses that mapped a life of hard survival. "But when you're living on the streets, when you're invisible to everyone walking past you, when the only time people look at you is to tell you to move along, dying doesn't seem like the worst thing that could happen." The weight of his words settled over the room like a heavy blanket. I thought about my own life, the apartment I'd go home to, the food in my refrigerator, the certainty that if I got sick, I could seek help without fear. These were things I took for granted, things Marcus had been denied not by any failing of his own, but by a cascade of circumstances that could happen to anyone. Dr. Keller cleared her throat, and I could see she was affected too, though she hid it better than I could. "Mr. Webb, we're going to need to remove that blade surgically. It's going to require a specialist, an ENT surgeon. We're calling one in now. How much is this going to cost?" The question came automatically, worn smooth by years of impossible choices. "Let's worry about keeping you alive first," I said. But I knew it wasn't enough. I knew Marcus was calculating costs he couldn't pay, debts that would compound and follow him, making an already impossible situation even more dire. "I don't have insurance," he said, his voice flat. "I don't have anything. This is going to bankrupt me, and I'm already at rock bottom. There's no lower to go." "We have financial assistance programs," Dr. Keller said. "Social services will work with you." But I could see it in his face. He didn't believe her. He'd heard promises before, and they'd all turned to ash. The system that had failed him repeatedly was now asking him to trust it again, and trust was a luxury he couldn't afford. Before I could say anything else, Sarah appeared at the curtain. "Dr. Keller, Dr. Qureshi is on his way. ETA 15 minutes. Good. Start Mr. Webb on IV antibiotics, ceftriaxone and metronidazole. And let's get a full metabolic panel and CBC. I want to see where we stand before surgery." As Sarah moved to execute the orders, I stayed beside Marcus's bed. He was staring at his hands, rough and scarred from years of exposure to cold and concrete and the casual violence of life without shelter. "Marcus," I said quietly, "can I ask you something?" He nodded without looking up. "You mentioned you have a daughter, Emily." His body went rigid, every muscle tensing. "I'm not trying to upset you," I continued carefully. "I'm just wondering, does she know you're here? Is there someone we should call?" "No." The word came out hard, final, a door slamming shut. "She's better off thinking I'm dead than knowing I'm alive and like this." "Like what?" "Worthless. A failure. Eating out of trash cans and swallowing razor blades. What kind of father does that make me? A human one. A father who's been dealt an impossibly difficult hand and is doing his best to survive it." He finally looked at me, and the pain in his eyes was almost physical. "You don't know anything about me, Doc. You don't know what I've done, what I've failed to do. Emily, she deserves better than a father who couldn't keep a roof over his own head, let alone hers. She deserves to know her father is alive and fighting to survive," I said. "That's not nothing. It's not enough. Maybe he was right. Maybe it wasn't enough, but it was something. And in that moment, something felt like all we had." "How old is she now?" I asked gently. 12. No, 13. Her birthday was last month." His voice broke. "I missed it. I miss all of them now." "When did you last see her?" 6 years ago. She was 7. Still believed in fairy tales and thought her dad could fix anything." He wiped at his eyes roughly. "Her mom got full custody after I lost the apartment. Can't blame her. I was a mess. Drinking too much, couldn't hold a job, couldn't hold anything together. She took Emily and moved across town. I tried to visit at first, but it was too hard. too painful to see what I was putting them through. So I stopped going, told myself it was better that way. Was it? No, it was cowardice. I was too ashamed to face my own daughter, so I abandoned her. What kind of father does that? The kind who's in pain, the kind who's drowning and doesn't want to pull his child under with him. That's a generous interpretation. It's the truth. He shook his head, but I could see I'd planted something. A seed of possibility that maybe, just maybe, he wasn't the irredeemable failure he'd convinced himself he was. Dr. Hassan Qureshi arrived exactly 15 minutes later, moving with the purposeful efficiency of a surgeon accustomed to emergency calls. He was in his mid-40s, with dark hair graying at the temples and steady hands that had performed hundreds of delicate procedures. He wore wire-rimmed glasses that gave him a scholarly appearance, and when he spoke, his voice carried the weight of authority tempered by compassion. He reviewed the x-rays first, his expression grave as he traced the blade's position with one finger on the screen. He zoomed in, examined different angles, and pulled up the lab results that had just come back. "This is bad," he said without preamble, his accent carrying traces of his childhood in Pakistan. "The blade's orientation is particularly dangerous. If it shifts even slightly, it could sever the carotid or perforate into the mediastinum. And these inflammatory markers. His white count is elevated, CRP is through the roof. He's already fighting a significant infection." "What's the approach?" Dr. Keller asked. "Endoscopic extraction under general anesthesia. I'll need the OR prepped immediately. We're looking at a 2-hour procedure, minimum. Possibly longer if the tissue damage is as extensive as I suspect." He turned to me, his dark eyes assessing. "You're the admitting resident?" "Yes, sir. Dr. Noah Reyes. Brief me on his complete history. I want to know everything. Medical, social, how long he's been symptomatic, what complications we might be walking into." I walked him through everything. The accidental ingestion, the 4 to 5 days of symptoms, Marcus's previous attempts to seek care and the barriers he'd faced, the lack of previous medical records, the socioeconomic factors that had delayed treatment. I mentioned the old scars Keisha had noticed, the signs of chronic malnutrition, the likelihood of other untreated conditions. Dr. Qureshi listened without interruption, his expression darkening as I spoke. When I finished, he was quiet for a moment, processing. 4 days, he said finally. He's been walking around for 4 days with this inside him, every swallow an act of torture. He didn't think he could get help, because the system failed him, multiple times from what you've described. Dr. Qureshi's voice carried anger now, controlled but present. I see this too often. Patients who delay care, not because they're ignorant or stubborn, but because they've learned that seeking help can make things worse. And now we're racing against sepsis and tissue necrosis, because society decided this man wasn't worth helping until he was literally dying. His words hung in the air, an indictment we all felt. But he's here now, Dr. Qureshi continued, his tone shifting back to clinical efficiency. And we're going to do everything we can. Let's get him to the OR within the hour. I want pre-op labs, a type and cross in case we need blood products, and someone from anesthesia to assess him. Given his nutritional status and potential for difficult intubation, we need to be prepared for complications. I'll coordinate everything, Dr. Keller said. As they moved into action, I returned to Marcus's bedside. He was lying back now, the pre-surgical sedatives already beginning to take effect. His eyes were half closed, but he tracked my movement as I approached. "Hey, Doc," he said, his voice slurred. "They're gonna cut me open, huh? They're going to remove the blade. Dr. Qureshi is an excellent surgeon. You're in good hands. If something goes wrong, nothing's going to go wrong. But if it does," his hand shot out, grabbing my wrist with surprising strength despite the sedatives. "If I don't wake up, I need you to know something. Marcus, you're going to be fine. Please." His grip tightened, desperate. "Just listen." I nodded, my throat tight. "If I don't make it, find Emily. Tell her. Tell her I tried. Tell her I thought about her every single day. Tell her the last thing I remembered, the last thing I held on to when everything else was gone, was her laugh. The way she used to laugh at my terrible jokes." Tears streamed down his face now. "Tell her I'm sorry. For everything. For leaving. For not being strong enough. For not being the father she deserved. You're going to tell her yourself," I said firmly, but my voice cracked. "You hear me? You're going to survive this, and you're going to get the chance to tell her everything you need to say. You're going to rebuild that relationship. You're going to be there for her birthdays and her graduation and all the moments you've missed. But you have to fight. You have to make it through this." He searched my face, looking for something, Truth, maybe, or hope, or just the strength to believe that survival was possible. Whatever he found must have been enough, because he nodded slowly and released my wrist. "Okay," he whispered. "Okay, I'll try." That's all any of us can do. They came for him then. The surgical team with their precise choreography, Sarah checking his IV lines one last time, Dr. Qureshi reviewing the surgical plan with the anesthesiologist. They wheeled him toward the operating room, and I walked beside the gurney until we reached the double doors marked "Authorized Personnel Only." Marcus looked up at me one last time. "Thanks, Doc, for seeing me. My name's Noah," I said, "and I'll be here when you wake up. That's a promise." They took him through the doors, and I stood there watching until the doors swung shut, leaving me alone in the hallway with the smell of antiseptic and the distant sound of machines keeping people alive. The surgery took 3.5 hours. I should have gone home. My shift had officially ended 2 hours ago, but I couldn't leave. I found myself in the surgical waiting area, a space designed for families but occupied now by just me, sitting in an uncomfortable plastic chair with a cold cup of coffee I wasn't drinking. The waiting area was painted in calming blues and grays, with abstract art on the walls that was probably meant to be soothing, but just felt empty. There was a television mounted in the corner, playing the news on mute. Outside the windows, night had fallen, the city lights creating constellations against the darkness. Other residents came and went, giving me curious looks. A few asked if I was okay. I told them I was fine, just waiting for a patient's surgery to finish. They accepted this at face value and moved on, back to their own endless responsibilities. Sarah checked on me once, bringing me a sandwich I didn't eat and a look of concern I couldn't quite meet. "You should go home, Noah," she said gently, sitting down beside me. "Get some rest. I need to know he's okay. He's not your only patient, and even if he survives the surgery, there's a long recovery ahead. You can't be here for all of it. I know that. Do you?" She studied my face in the harsh fluorescent light. "Because you've been here for 14 hours, and you're running on fumes. You can't help anyone if you collapse." She was right, of course, but right didn't matter. What mattered was Marcus, alone in an operating room, fighting for a life he'd been ready to give up on. "Did I ever tell you about my first year of residency?" Sarah asked. "No. There was this patient. Young guy, 23, came in with what we thought was appendicitis. Turned out to be a massive tumor, inoperable, wrapped around his intestines, his liver, everything. We sent him home with palliative care and a prognosis of 6 weeks. That's awful. It was. But here's the thing. I couldn't let it go. I spent weeks researching alternative treatments, experimental trials, anything that might help. I called oncologists across the country. I lost sleep. I stopped eating right. My boyfriend at the time said I was becoming obsessed, and he was right. I was. What happened? He died.
6 weeks, almost to the day. And all my research, all my obsession, all the sleep I lost and relationships I strained, it didn't change a damn thing. But it almost broke me. I had to take a leave of absence, see a therapist, rebuild myself from the ground up. I looked at her, seeing her in a new light. Sarah always seemed so together, so competent and unflappable.
The idea that she'd been where I was now, that she'd fought this same battle with compassion versus self-preservation, made her more real somehow. "How did you come back from that?" I asked. "I learned that caring doesn't mean destroying yourself, that you can be compassionate without being consumed. It's a hard lesson, Noah. One I'm still learning, even after 10 years of nursing. So what? I should just not care? No. Care deeply. Care with your whole heart, but also take care of yourself. Because if you burn out, if you break, then you can't help anyone. Not Marcus, not your next patient, not the hundreds of people who will need you over the course of your career." Her words made sense logically. Emotionally, they felt impossible. How do you care about someone's life without caring so much it consumes you? Where's the line between compassion and obsession? Before I could respond, Dr. Qureshi emerged from the surgical wing, still in his scrubs, his surgical cap pushed back on his head. Sweat darkened the fabric at his temples, and fatigue lined his face. I stood so fast my cold coffee nearly spilled, the cup tumbling but Sarah catching it reflexively. "How is he?" I asked, my heart hammering. "Alive. The extraction was successful, though complicated." "Complicated how?" Dr. Qureshi gestured for me to sit, then took the chair across from me. Sarah slipped away quietly, giving us privacy. "The blade had caused significant tissue damage," Dr. Qureshi began. "More than the X-ray showed. There was extensive inflammation, abscess formation, and we had to debride necrotic tissue from a section about 3 centimeters long. The blade had essentially been sawing through his esophagus with every swallow for days. My stomach turned. Additionally, there was a small perforation in the posterior esophageal wall. Not large, maybe 4 millimeters, but enough to allow gastric contents to leak into the mediastinal space. We caught it early. No signs of mediastinitis yet, but it was close. How did you repair it? Primary closure with reinforcement. We also placed a drain to prevent fluid accumulation. He's on broad-spectrum antibiotics, and we'll be monitoring him closely for any signs of leak or infection. What's his prognosis? Dr. Qureshi leaned back, the chair creaking under his weight. Guardedly optimistic. The next 48 to 72 hours are critical. We're watching for signs of mediastinitis, sepsis, anastomotic leak, and aspiration pneumonia. His nutritional status is poor, which will complicate healing. And his immune system is likely compromised from chronic stress and inadequate nutrition. But he can survive this? Yes. If infection doesn't set in, if the repair holds, if we can get adequate nutrition into him, yes, he can survive this. But it's going to be a long road, Dr. Reyes. This isn't a simple extraction and discharge. We're talking weeks of recovery, possibly more. Can I see him? He's in recovery, still intubated. He won't wake up for several more hours. But yes, you can see him. Dr. Qureshi paused, studying me with those dark, assessing eyes. You're the resident who admitted him? Yes. Dr. Keller mentioned you've been advocating for him, coordinating follow-up care, looking into housing resources. I'm trying. That's good. Patients like Marcus, they fall through the cracks. It's easy to fix the immediate problem and send them back to the circumstances that caused it in the first place. The medical system is designed for acute intervention, not for addressing the social determinants that make people sick. The fact that you're thinking beyond the acute issue, that you're seeing the whole person, that's what makes a good doctor. His words should have felt like validation. Instead, they felt like responsibility settling onto my shoulders, heavy and permanent. Can I ask you something, Dr. Qureshi? Of course. How do you do this? How do you operate on someone like Marcus, knowing that even if the surgery is successful, he's likely going back to the same situation that nearly killed him? Dr. Qureshi was quiet for a moment, and I wondered if I'd overstepped. I ask myself that question often, he said finally, and I don't have a perfect answer. But what I've learned is this. I can't fix society from an operating room. I can't solve homelessness or poverty or the structural failures that create patients like Marcus. But I can do my job with excellence and compassion. I can treat each person on my operating table as if they're the most important person in the world, because in that moment, they are. And sometimes, just sometimes, that's enough to give someone a second chance. He stood, his knees cracking slightly. Marcus is alive because he found his way here, to a hospital where the admitting resident saw him as a person worth fighting for. That matters, Dr. Reyes. Don't underestimate the power of being seen. The recovery room was quiet. The lights dimmed for the patient sleeping off anesthesia. Marcus was in the far corner, surrounded by machines that beeped and hummed with mechanical precision. A ventilator breathed for him, his chest rising and falling with artificial rhythm. IVs snaked into both arms, delivering antibiotics and fluids and nutrition his body desperately needed. I stood at the foot of his bed, reading through the post-op notes on my tablet. Everything was as Dr. Qureshi had described. The extraction, the tissue damage, the repair of the perforation. The surgical report was clinical, detached, a series of procedures reduced to medical terminology that could have been describing anyone. But looking at Marcus, at the man beneath the tubes and monitors, I saw something else. I saw someone who'd survived not just the blade, but years of systematic abandonment, who'd eaten from trash cans because society had decided his hunger wasn't worth addressing, who'd nearly died because seeking help felt more dangerous than suffering alone. The monitor showed his vital signs: heart rate steady at 72, blood pressure holding at 110/70, oxygen saturation at 98% on the ventilator. Numbers that looked stable, reassuring, normal. But behind those numbers was a human being fighting for survival against odds that never should have been so steep. You're still here. I turned to find Dr. Keller standing behind me, her white coat exchanged for a regular jacket, her bag slung over her shoulder. She looked tired, the kind of exhaustion that comes from a long shift where every decision matters and every patient deserves more than you can give. Couldn't leave, I said. I figured. She moved to stand beside me, looking at Marcus with an expression I couldn't quite read. Dr. Qureshi says the surgery went well, all things considered. He's not out of danger yet. No, but he's alive. That's more than he would have been if he'd stayed on the streets, too afraid to seek help. We stood in silence for a moment, the only sound the steady beep of monitors and the soft hiss of the ventilator, breathing life into lungs that had forgotten how to trust. "Can I tell you something, Dr. Reyes?" Dr. Keller said finally. "Something I don't usually share with residents. Of course. 20 years ago, when I was a young attending, I had a patient not unlike Marcus, homeless man, came in with pneumonia that had progressed to sepsis. We treated the infection, got him stable, discharged him with antibiotics and instructions to follow up at a community clinic. What happened? He died 3 weeks later, froze to death in an alley 2 blocks from this hospital. Never picked up his antibiotics because he couldn't afford the copay. Never made it to follow up because the clinic required ID he didn't have. Just died alone. Probably confused about why the hospital that saved him couldn't save him from the cold." Her voice was steady, but I could hear the weight behind it. 20 years of carrying that failure. I was furious, she continued, at the system, at society, at myself for not doing more. I vowed I'd never let it happen again. So I started making calls, pulling strings, fighting with social services and insurance companies and administrators. I became a crusader for every homeless patient who came through these doors. That's admirable. It was exhausting. Within 6 months, I was barely sleeping. My marriage was falling apart. My husband said I came home angry every night, ranting about injustice and incompetence, unable to let go of the day's failures. I was snapping at colleagues, making mistakes because I was running on empty and righteous fury. And you know what? People were still falling through the cracks, because the system was bigger than me, bigger than my anger, bigger than my determination to single-handedly fix it. So you gave up? No. I learned to be strategic, to pick my battles, to recognize that I could make a difference without martyring myself on the altar of every systemic failure I witnessed. She looked at me directly, her gray eyes holding mine. "You remind me of myself back then, Dr. Reyes. You've got fire, compassion, a genuine desire to help people, not just treat diseases. But if you don't learn to manage it, that fire will consume you. You'll burn out before you finish residency, and all that potential, all that compassion will be wasted. How do I do that? How do I care without being consumed?" That's the question every good doctor has to answer for themselves. There's no universal solution, no formula that works for everyone. But I'll tell you what works for me. I do what I can, within my sphere of influence, and I make peace with the fact that it's not everything. I treat the patient in front of me with dignity and competence. I advocate when I can, through proper channels, without sacrificing my own well-being. And then I go home, and I don't carry the weight of the entire broken system on my shoulders, because that weight will crush you, and crushed doctors help no one. Doesn't that feel like giving up? Some days, yes. Other days, it feels like survival. Like choosing to be a doctor for the long haul rather than burning bright and fast and leaving the profession before I'm 40, another casualty of compassion fatigue. She put a hand on my shoulder, the gesture surprisingly paternal. "You're going to have to find your own balance, Dr. Reyes. But I hope you'll remember that taking care of yourself isn't selfish. It's necessary. Because the world needs more doctors like you. Doctors who care, who see people instead of just cases. Don't let the system destroy that before you've had a chance to make a real impact." She left, and I stayed with Marcus, her words echoing in my mind alongside Dr. Qureshi's and Sarah's. They were all saying the same thing in different ways. Care, but don't be consumed. Help, but don't destroy yourself in the process. Make a difference, but recognize the limits of what one person can do. It sounded so reasonable when they said it. But standing there in the dim recovery room, watching Marcus's chest rise and fall with mechanical precision, I wasn't sure I knew how to care any other way than completely. Marcus woke up 18 hours later. I was in the middle of morning rounds when Sarah paged me. "Dr. Reyes, your patient in Recovery Bay 3 is extubated and alert." I excused myself from the attending I was shadowing. Dr. Marquez, a cardiologist who'd been explaining the finer points of ST segment elevation, and hurried to the recovery wing. My heart was pounding, a mixture of relief and anxiety. Alive and awake meant Marcus had survived the immediate danger, but it also meant facing whatever came next. Marcus was sitting up slightly when I entered, the breathing tube removed, an oxygen cannula in his nose providing supplemental oxygen. The ventilator had been wheeled away, replaced by a standard nasal cannula. His eyes found mine immediately, and I saw confusion there, mixed with something that might have been relief or fear or both. "You made it," I said, unable to keep the relief out of my own voice as I approached his bedside. His hand moved to his throat, touching it gingerly, feeling the bandages and the tender skin beneath. When he spoke, His voice was hoarse, barely more than a whisper, each word clearly causing him discomfort. Hurts. It will for a while, I said, pulling up a chair beside the bed and sitting so we were at eye level. But you're going to be okay. We got the blade out. Dr. Qureshi did excellent work. He closed his eyes, and for a moment, I thought he might cry. His face contorted with emotion, relief, grief, exhaustion all mixing together. But when he opened them again, they were dry, though red-rimmed with fatigue and the remnants of anesthesia. How bad was it? He asked. I debated how much to tell him, how much detail a patient in his condition needed. But Marcus deserved the truth. Bad enough. The blade had caused significant damage to your esophagus. There was infection, tissue death, and a small perforation that the surgeon had to repair. But Dr. Qureshi did excellent work. The repair looks good, and your body is already starting to heal. How long do I have to stay here? At least a week, possibly 2 depending on how you recover. We need to make sure there's no infection, that the repair holds, that you can swallow safely. You'll start on liquid nutrition today, and if that goes well, we'll gradually progress to soft foods. He nodded slowly, processing this information with the careful attention of someone who'd learned to think through every implication. Then, inevitably, I can't pay for a week in the hospital. Marcus, I'm serious. I already can't pay for what's been done. The surgery alone is probably, what? 50,000? 100,000? And now another week or 2? That's debt I'll never escape. They'll garnish wages I don't have, ruin credit that's already destroyed. I'll be even worse off than before. We have programs. I've heard about programs. They help some people. People with jobs and bank accounts and addresses. Not people like me. People like me, we just accumulate debt until we give up and stop seeking help altogether. The bitterness in his voice was earned, justified by experience. I wanted to argue, to insist that we'd figure it out, that money didn't matter when a life was at stake. But I'd seen enough during my residency to know he wasn't entirely wrong. The healthcare system wasn't designed for people without resources. It was designed for people who could pay, and everyone else had to fight for scraps, navigate bureaucratic mazes, prove they were worthy of help. Let me worry about that, I said finally. Right now you need to focus on healing. Why are you doing this? The question was quiet, almost vulnerable. Why do you care what happens to me? You don't know me. I'm just another patient, another case. Why can't you just treat me and move on like every other doctor? I'd been asked variations of this question before, by patients, by colleagues, by my own reflection in the mirror during long shifts, and I never had a perfect answer. How do you explain that caring isn't always a choice you make? That some people walk into your life and something in their story hooks into your chest and won't let go? Because you deserve help, I said. Because what happened to you was an accident, a consequence of circumstances no one should have to face. And because I became a doctor to make a difference. That's meaningless if I only help people who are easy to help. Marcus studied my face for a long moment, his eyes searching for something. Truth, maybe, or ulterior motives, or just confirmation that I meant what I said. You really believe that? I have to. He was quiet, then said, Thank you. You don't have to thank me. Yeah, I do. Most places would have stabilized me and sent me on my way, given me a prescription I can't afford and instructions to follow up with doctors I can't see. You're actually trying to help. That's rare. Rarer than you probably realize. I didn't know what to say to that, so I changed the subject. Are you in pain right now? Some. Not as bad as before. Whatever they've got me on is working. I'll make sure you stay on adequate pain management. And we're going to start you on a liquid diet today. See how you tolerate it. If that goes well, we can progress to soft foods tomorrow, then regular foods once the swelling goes down. Sounds fancy. Despite everything, I smiled. Hospital food is many things. Fancy isn't one of them. That drew a small smile from him too. Brief but genuine, a glimpse of the person he'd been before circumstances stripped everything else away. Over the next hour, I performed a thorough examination, checking his vitals, assessing his throat, reviewing his medication regimen. Everything looked stable. The antibiotics were working. His white blood cell count was coming down from its peak, and he had no fever. The repair seemed to be holding. No signs of leaking or abnormal drainage. Against considerable odds, Marcus Webb was surviving. As I was preparing to leave, he called out, "Doc?" I turned back. "My daughter, Emily. You asked about her before the surgery." "I remember. I've been thinking about what you said, about her deserving to know I'm alive." His voice cracked slightly, emotion threatening to overwhelm him. "I don't know if I'm ready for that. Don't know if she'd even want to see me after all this time. Would you like help figuring that out? He looked uncertain, scared even, like a man standing at the edge of a cliff trying to decide whether to jump. But then he nodded. Yeah, maybe. I don't know what I'd say to her. Sorry I abandoned you because I was too ashamed to face my own failure? That's not much of an apology. It's honest, and honesty is a start. What if she hates me? What if she doesn't? What if she's been hoping all these years that you'd come back? Marcus closed his eyes, tears leaking from the corners. That might be worse. Knowing she was hoping, and I let her down, then don't let her down anymore. Be the father she hopes you can be, starting now. I don't know how to do that from here. From this hospital bed with this debt, with nowhere to go afterward. We'll figure it out, one step at a time. He opened his eyes and looked at me with an expression I couldn't quite name. Gratitude mixed with desperation, mixed with the faintest glimmer of hope. Okay, he whispered. Okay, let's try. The next 72 hours were critical in ways I hadn't fully anticipated. Marcus developed a low-grade fever on day 2, which sent the entire medical team into high alert. We ran blood cultures, chest x-rays, and adjusted his antibiotic regimen. I found myself checking on him during every break, every spare moment between other patients, sometimes just standing outside his room watching the monitors through the doorway. The fever peaked at 101.3 degrees Fahrenheit that evening. Dr. Qureshi was paged, and he came down from his office to personally assess the situation. Could be a reaction to the surgery, he said, examining Marcus's throat and the surgical site. Could be early signs of infection. We need to be vigilant. We were. For 18 hours, Marcus's room became a hub of constant activity. Nurses checking vitals every hour, respiratory therapists monitoring his oxygen levels, infectious disease specialists consulting on antibiotic choices. Marcus himself seemed to shrink beneath all the attention, overwhelmed by the sudden intensity of care after years of medical neglect. Am I dying? He asked me during one of my visits, his voice small. No, we're just being careful, making sure we catch any problems early. Feels like dying. Feels like everyone's preparing for the worst. We're preparing to prevent the worst. There's a difference. The fever broke on day 3, much to everyone's relief. Marcus's temperature dropped back to 98.9. His blood cultures came back negative, and the repeat chest x-ray showed no signs of aspiration or pneumonia. The consensus was that his body had simply been fighting the trauma of surgery and the existing infection, and the fever was part of that battle. By day 4, Marcus was tolerating clear liquids, broth, apple juice, water, with minimal discomfort. He ate with the slow, deliberate concentration of someone who'd forgotten what regular meals felt like, savoring each spoonful of broth like it was a gourmet dinner. This is the best food I've had in years, he told me, and I couldn't tell if he was joking. It's literally just chicken broth, I said. Still, it's warm, it's clean. I didn't have to dig through trash to find it. That makes it the best meal I've had in a long time. The matter-of-fact way he said it broke my heart. By day 5, we progressed him to full liquids and soft foods. Jell-O, mashed potatoes, pudding. He tolerated them well, though swallowing still caused visible discomfort. But the color was returning to his face, and he was sitting up more, engaging with the nursing staff, asking questions about his care. But the bigger challenge was looming larger with each passing day. What happened after discharge? I'd spent hours on the phone with social services, navigating a labyrinth of programs and prerequisites that seemed designed to discourage rather than help. Most shelters required identification documents Marcus had lost years ago. Most transitional housing programs had waiting lists measured in months, not days. Most food assistance programs required an address, which was a catch-22 when you were homeless. It was a system designed to keep people trapped, to make sure that once you fell through the cracks, climbing back out was nearly impossible. I called the Department of Social Services 3 times, each time spending 40 minutes on hold before speaking to someone who couldn't actually help, but who would transfer me to someone else who also couldn't help. I contacted 7 different shelters, all of which were at capacity. I reached out to 4 community health clinics about follow-up care, and all of them had waiting lists that extended past Marcus's anticipated discharge date. Every door I knocked on seemed to lead to another locked door, another barrier, another reason why helping Marcus was someone else's problem. On day 5, frustrated and exhausted, I was sitting in the hospital cafeteria staring at a salad I wasn't eating when Patricia found me. Patricia was a nurse who'd worked at St. Halsted for 30 years. She was in her early 60s, with gray hair she wore in a practical bun and the kind of competence that comes from decades of seeing everything. She sat down across from me without asking, her own tray of food untouched. "I heard you're trying to find housing for the man with the swallowed blade," she said without preamble. "Marcus Webb, yes, but I'm hitting walls everywhere I turn. How many places have you called? 15? Maybe 20? I've lost count. And they're all saying the same thing? No room, waiting lists, need documentation?" Essentially, Patricia nodded, unsurprised. "The system's broken. Has been for as long as I've been nursing. But there's a program most people don't know about." My head snapped up. "What kind of program?" "It's a pilot initiative privately funded by a group of physicians who got tired of watching patients cycle through the emergency department. It's specifically for homeless patients discharged from acute medical care. They provide transitional housing, case management, job training, the whole package. Why haven't I heard of it? Because it's small, and they're selective. Limited beds, maybe 20 at any given time. They prioritize cases with significant medical needs and demonstrated motivation to engage with services. How do I get Marcus into it?" She pulled a business card from her pocket and handed it to me. "Call this woman. Her name is Dr. Angela Morrison. She runs the program. Tell her Patricia from St. Halstead sent you and explain Marcus's situation. She'll listen." I looked at the card. Simple white cardstock with a name, phone number, and email address. Nothing fancy, but it felt like a lifeline. "Why are you helping me with this?" I asked. Patricia smiled, a sad kind of smile that held too many memories. "Because 25 years ago, I had a patient like Marcus. Young man, early 30s, homeless after a divorce and job loss. We treated his pneumonia and sent him back to the streets. He died 2 months later from exposure. I've always wondered if I could have done more, if I should have pushed harder to find him resources. I can't help that patient anymore, but maybe I can help this one." "Thank you," I said, the words feeling inadequate. "Don't thank me yet. Just call her." "And Noah?" She used my first name, which she rarely did. "Don't give up on him. People like Marcus, they've been let down so many times they expect it. Be the one person who doesn't let him down." I called Dr. Morrison that afternoon during my lunch break, stepping outside the hospital into the November cold for privacy. The phone rang 3 times before a woman answered, her voice warm but businesslike. "Dr. Morrison. Dr. Morrison, my name is Dr. Noah Reyes. I'm a resident at St. Halstead Hospital. Patricia suggested I call you about a patient who might be eligible for your housing program." Patricia's recommendations always get my attention. "Tell me about your patient." I explained Marcus's situation, the accidental ingestion of the razor blade, the delayed care due to fear and past experiences being turned away from hospitals, the surgery and complications, the lack of follow-up resources, the daughter he hoped to reconnect with. I tried to present just the facts, but my voice betrayed how much I cared about the outcome. When I finished, Dr. Morrison was quiet for a moment. "That's quite a case," she said finally. "And you're sure the ingestion was accidental?" "Absolutely. He thought he was eating a sandwich he found in a trash can. The blade was hidden inside. And he's motivated to engage with services? Because we can provide housing and support, but we can't force someone to participate. They have to want help. He's motivated. He wants to rebuild his life, reconnect with his daughter. He just needs a chance. Can he come in for an interview?" My heart leaped. "When?" "Day after discharge." "I'll make time. Have him come to this address." She rattled off an address in a neighborhood I vaguely knew. "At 10 in the morning. Tell him to bring any documentation he has, but if he doesn't have anything, we'll work with it. We're used to patients who've lost everything." "Really? You'll see him?" "Dr. Reyes, I started this program because I was tired of watching patients return to the same circumstances that made them sick in the first place. The emergency department is full of people who wouldn't be there if we addressed their housing, their nutrition, their basic human needs. If Marcus is motivated to engage with our services, we'll find a place for him." I could have cried with relief. Instead, I thanked her profusely and promised to have Marcus there. When I told him about the interview later that evening, his reaction was more muted than I expected. "An interview," he said flatly, his voice still hoarse. "It's a good opportunity, Marcus. Housing, case management, help finding employment, connections to healthcare. I've done interviews before, for shelters, for programs, for jobs. They all want you to prove you're worth helping, that you're one of the deserving poor, not like those other homeless people who are lazy or addicted or just not trying hard enough. This is different, is it?" He looked at me with eyes that had seen too many promises broken. "Because from where I'm sitting, it sounds like another hoop to jump through, another test to pass, another chance to be judged and found wanting. Dr. Morrison isn't like that. She started this program specifically to help people the system has failed. The system's full of people who claim they want to help. Most of them just want to feel good about themselves while actually changing nothing. His cynicism was hard to argue with because it was based on lived experience. How many times had Marcus been promised help that never materialized? How many well-meaning people had offered assistance only to disappear when it got complicated or inconvenient? I can't promise it'll work out, I said honestly. I can't guarantee they'll accept you, or that the program will be everything you need. But I can promise that this is a real opportunity, and that Dr. Morrison has helped people in situations like yours rebuild their lives. That's worth trying for, isn't it? Marcus was quiet for a long time, staring at his hands. Finally, he said, "What do I have to lose?" "Exactly. Okay, I'll go to the interview. But Noah?" He used my first name, which he'd started doing more frequently. "If this falls through, if it's just another dead end, I don't know if I have another disappointment in me. You understand?" "I understand." "Good. Because I'm trying here. I'm really trying. But hope is exhausting when you've been let down as many times as I have." Marcus was discharged on day 7. The morning was gray and cold, typical November weather that made everything feel provisional and temporary. I met Marcus in his room as he was getting dressed, slowly, carefully, his movement still guarded against pain. He'd been given a bag of supplies, a week's worth of antibiotics, pain medication, detailed wound care instructions, emergency contact numbers, and information about follow-up appointments. He looked better than when he'd arrived, cleaner, rested, the haunted, desperate look in his eyes replaced with something more complex. Not quite hope, but maybe cautious possibility. "You ready?" I asked. "As I'll ever be." I handed him 2 folders. "This one has all your medical information. Discharge instructions, medication list, follow-up appointments. Keep it safe. You'll need it for Dr. Morrison's program and for any future medical care." He took it carefully, handling it like something precious. "And this folder has information about the housing program. Your interview is tomorrow at 10. The address is on the form, and I've included a map and bus route. The social worker downstairs has arranged a bus pass and confirmed a bed for you tonight at the Haven shelter. They're holding it specifically for you. You did all that? It's my job." "No, it's not. Your job was to treat my throat. Everything else, that's you choosing to care." I didn't know how to respond to that, so I just nodded. Marcus put both folders carefully into a plastic bag the hospital had provided for his belongings. "What if I fail? What if I get into this program and I screw it up?" "You won't. You don't know that. I have a pretty solid track record of screwing things up. Lost my job, lost my apartment, lost my family. What makes you think I won't lose this too? Because you're not the same person who lost those things. That person was drowning, overwhelmed, without support or resources. This time, you'll have help. You'll have people invested in your success. That makes all the difference. Does it?" Yes. He wanted to believe me. I could see it in his face, that tentative reaching toward hope that he was terrified to fully embrace. We walked to the hospital entrance together, moving slowly to accommodate Marcus's healing body and his exhaustion. The social worker, Helen, was waiting with the bus pass and detailed directions to the shelter. She was a kind woman in her 40s who'd been nothing but patient through all my pestering calls. "Mr. Webb," she said, shaking his hand. "I'm glad to see you looking so much better." "Thank you, ma'am. The shelter's expecting you. They know about your medical situation, and they've set aside a quiet bed where you can rest. And Dr. Reyes has given you everything you need for tomorrow's interview?" "Yes, ma'am." "Good. This is a real opportunity, Mr. Webb. Dr. Morrison's program has helped a lot of people turn their lives around. I hope you'll take full advantage of it." "I'll try." We stood there under the overhang, rain falling just beyond the edge of the concrete. It seemed to rain constantly in this city, a steady gray drizzle that turned the world soft and blurred at the edges. "Marcus," I said, and he turned to look at me. "Take care of yourself. Follow the medication schedule exactly. Don't skip doses even if you're feeling better. Keep the wound clean and dry. And if anything feels wrong, if you develop a fever, if you have trouble swallowing, if the pain gets worse, come back immediately. Don't wait." "I will. Promise me." "I promise." I held out my hand and he shook it. His grip was firm, stronger than it had been a week ago, but I could still feel the tremor of weakness, the long road to recovery still ahead. "Good luck tomorrow," I said. "You're going to do great. From your mouth to God's ears." Then he walked into the rain, the plastic bag of belongings clutched under his jacket to keep it dry, and disappeared into the gray afternoon. I stood there watching until I couldn't see him anymore, hoping I'd done enough, terrified that I hadn't, knowing that from this point forward, Marcus's fate was largely out of my hands. The next 2 weeks were a blur of shifts and patients and the relentless rhythm of hospital life. I treated a 12-year-old girl with a ruptured appendix who required emergency surgery, a woman in her 60s having her third heart attack, refusing to quit smoking even as we explained the consequences, a college student with alcohol poisoning who'd nearly died at a fraternity party, a construction worker who'd fallen from scaffolding and broken 6 ribs. Each case demanded my full attention, and I gave it. But part of my mind was always elsewhere, wondering about Marcus, hoping he'd made it to the interview, hoping the program had accepted him, hoping he was okay. I didn't hear anything, and the silence was agonizing. Dr. Keller noticed my distraction during rounds one morning. She pulled me aside after we'd finished reviewing overnight admissions, her expression softer than usual, but still carrying that edge of evaluation. "Dr. Reyes," she said, "what's on your mind?" "I'm focused on my patients. You're physically present. Mentally, you're somewhere else. Your presentations are fine, your clinical judgment is sound, but I can see you're not fully here. Is it the homeless patient, Marcus Webb?" I hesitated, then nodded. "I just want to know if he's okay, if he got into the program, if he has somewhere safe to stay." Dr. Keller sighed, a sound heavy with years of having this same conversation with idealistic young doctors. "Dr. Reyes, you did everything you could. You treated his acute condition excellently. You coordinated resources beyond what any resident is expected to do. At some point, you have to let go. What if he fell through the cracks? What if... Then it's not your failure. It's the system's failure. And you can't fix the system from inside this hospital. Isn't it everyone's failure if we all just accept that the system is broken and do nothing about it? That's not what I'm saying. What I'm saying is that you, individually, cannot carry the weight of every systemic failure you encounter. You'll burn out before you finish your residency if you try. You'll become another casualty of compassion fatigue and will lose a good doctor. Is that what you want? No. Then learn to let go. Learn to do your job with excellence and compassion, and then go home and rest so you can do it again tomorrow." Her words were meant to be protective, pragmatic guidance from someone who'd survived decades in this profession. But they felt like a betrayal of everything I'd promised Marcus, everything I'd promised myself when I chose to become a doctor. "I have to try," I said quietly. "Even if I fail, I have to try." Dr. Keller studied me for a long moment, then shook her head with something that might have been resignation or respect. "You're going to learn the hard way, aren't you? Apparently. Just promise me something. Promise me that when it gets too hard, when you're drowning in other people's pain, you'll ask for help. Pride kills doctors, Dr. Reyes. Don't let it kill you. I promise." She nodded and left, and I stood there in the hallway wondering if I was being brave or foolish, committed or obsessed. My pager went off. Trauma incoming. I had to go. But that night, lying in my apartment unable to sleep, I made a decision. I was going to find out what happened to Marcus Webb, even if it meant stepping outside the boundaries of my role as his former doctor, even if it meant facing answers I didn't want to hear. The next morning, I called Dr. Morrison's office. "Dr. Reyes," she said when she picked up, recognition warming her voice. "I was actually planning to call you." My heart raced. "About Marcus Webb?" "Yes. I wanted to thank you for the referral and to let you know that we've accepted him into the program." Relief flooded through me so intensely I had to sit down. "He's in? He's okay?" "More than okay. He came to his interview on time, despite obvious pain and exhaustion. He was honest about his situation, about his past failures and his hopes for the future. He didn't make excuses or try to present himself as anything other than what he is, a man who's had terrible luck and made some bad choices, but who wants desperately to rebuild his life. That's wonderful. We've placed him in one of our transitional apartments. It's small but clean, fully furnished, utilities included. He's meeting with a caseworker 3 times a week to work on job skills, financial literacy, and long-term housing goals. And Dr. Reyes? He's asked about seeing his daughter. I had to blink back tears. Really? Really? The caseworker has made contact with his ex-wife, explained the program and the support Marcus is receiving. She's cautiously willing to allow supervised contact, starting with phone calls and potentially progressing to in-person visits if Marcus demonstrates stability. That's incredible. Would it be appropriate for me to visit him, just to see how he's doing? I don't see why not. In fact, I think Marcus would appreciate it. Let me give you the address. The transitional housing facility was in a neighborhood I rarely visited, a working class area that was diverse and showing signs of both revitalization and persistent poverty. Corner stores advertised, "We accept EBT." Community murals brightened otherwise drab walls. People sat on stoops despite the cold, wrapped in coats and blankets, claiming public space in a world that often told them they didn't belong. The building itself was modest, a 3-story structure with clean brick and windows that actually had curtains. A small sign near the entrance read Morrison House in simple lettering. I stood outside for a moment, nervous for reasons I couldn't fully articulate. Then I pressed the buzzer for Marcus's apartment. His voice crackled through the speaker. "Yeah? Marcus? It's Dr. Reyes. Noah." A pause. Then, "Come on up. 3rd floor, apartment 3B. The interior of the building was clean if worn. Carpeted hallways that had seen thousands of footsteps, fluorescent lights that hummed slightly, the smell of cooking from various apartments creating a community fragrance of spices and sustenance. I climbed to the 3rd floor, my footsteps echoing in the stairwell, and found apartment 3B. The door opened before I could knock. Marcus stood there, and I almost didn't recognize him. His beard was trimmed neatly, no longer wild and unkempt. His hair was cut and combed. He wore clean jeans and a button-down shirt that might have come from a thrift store, but fit him well and looked intentional, not desperate. He looked 10 years younger, and there was something different in his eyes. Not quite happiness, but maybe the possibility of it. The first tentative steps toward believing that good things could happen. "Doc," he said, smiling genuinely. Come in. The apartment was small, a studio with a kitchenette, a bed neatly made with clean linens, a small couch that looked second-hand but comfortable, a bathroom visible through an open door. But it was his space. Clean, safe, warm. The walls were bare except for one photo tacked up near the bed. A picture of a young girl, maybe 7 years old, smiling at the camera. Emily. "This is amazing, Marcus," I said, and I meant it with my whole heart. "It's something." He gestured to the couch. "Sit. You want coffee? I actually have coffee now. Can you believe that? Coffee whenever I want it." "Sure." He moved to the kitchenette, and I watched him prepare 2 cups with the careful attention of someone who wasn't taking simple pleasures for granted anymore. His movements were still slightly guarded, protecting his healing throat, but there was confidence there too, ownership of space and routine. When he handed me the mug, our fingers brushed, and I saw the scars on his hands, marks from years of survival, alongside newer cuts and calluses from whatever work he'd been doing. "How are you feeling?" I asked. "Any trouble swallowing? Pain?" "Getting better every day. Still hurts sometimes, especially with solid food, but I'm following the diet plan they gave me, and I've got a follow-up with an ENT specialist next week." "That's great. Really great. Dr. Morrison told me you called to check on me. I wanted to make sure you were okay." "Why?" It was the same question he'd asked before, but with different weight now. Not accusatory or defensive, but genuinely curious. "I've been thinking about this a lot, about why you cared when nobody else did, and I think I finally figured it out." "Yeah? You saw me. Not just a homeless guy or a medical problem or a statistic about healthcare inequality. You saw me as a person, as Marcus. Do you know how rare that is? How long it's been since someone looked me in the eye and treated me like I mattered. You do matter. I'm starting to believe that again." His voice was thick with emotion. "And that's because of you. Because you refused to give up on me even when I'd given up on myself." I didn't know what to say. The gratitude in his voice felt too heavy, too personal. "I just did my job," I said finally. "No, you did more than your job. Way more. And I need you to know that it made all the difference." We sat in comfortable silence for a moment, drinking our coffee. Then Marcus said, "I talked to Emily." My head snapped up. "You did?" "On the phone. The caseworker facilitated it, called her mom, and explained everything. She was skeptical at first. Can't blame her after I disappeared for 6 years. But the caseworker explained the program, the support I'm getting, the progress I've made, and she agreed to let Emily talk to me." "How did it go?" His eyes welled up, tears gathering but not quite falling. "She sounds so grown up, 13 now. Her voice is different. Not that little girl voice I remember. She told me about school, about her friends, about how she wants to be a veterinarian because she loves animals. That's beautiful." I asked her if she remembered me, if she remembered any of the good times before everything fell apart. He wiped at his eyes.
She said she remembered our Sunday morning pancake tradition, how I used to make them in funny shapes, dinosaurs and stars and flowers. I couldn't believe she remembered that. Of course she remembered. Those are the moments that matter. I asked her if she was angry with me, If she hated me for leaving. His voice broke. She said she was angry, but she didn't hate me. She said she missed me and wanted to understand what happened. What did you tell her? The truth, that I got lost.
That I made mistakes and couldn't find my way back, but that I'm trying now. That I want to be her dad again if she'll let me. What did she say? She said she'd like that it would take time, but she'd like that. He was crying openly now. Years of grief and guilt and hope all pouring out. We're going to meet in person next month, just for an hour at a family services office with a social worker present, but it's a start. That's incredible, Marcus. That's everything. I'm terrified I'll mess it up, that I'll say the wrong thing or she'll look at me and be disappointed by what I've become. You won't mess it up. Just be honest. Be present. Show her that you're fighting to be better. That's all she needs to see. You really think so? I know so. We talked for another hour about his plans for job training, about the small victories of having groceries in his cupboard and a bed to sleep in, about the persistent struggles of rebuilding from nothing. When I finally left, he walked me to the door. Thanks for coming by, Doc. Noah. It means a lot. Keep me updated. Let me know how the meeting with Emily goes. I will. I promise. I walked back to my car feeling lighter than I had in weeks. The November rain had stopped, leaving the streets wet and reflective under the streetlights. Somewhere in the city, Marcus Webb was in his apartment, looking at a picture of his daughter and daring to hope that he might have a future worth living. 3 months passed. I completed my rotation in the emergency department and moved on to internal medicine. New patients, new challenges, new stories that hooked into my chest and wouldn't let go. But I thought about Marcus often, wondered how he was doing, hoped he was okay. Then, on a cold February afternoon during a rare break, my phone buzzed with an unknown number. I almost didn't answer, but something made me pick up. Doctor. Reyes? Noah? The voice was familiar but changed, lighter, steadier, filled with something that sounded like joy. Marcus? Yeah, it's me. I hope I'm not bothering you. Not at all. How are you? Good. Really good, actually. Better than I've been in years. I wanted to call and let you know I got a job. My heart swelled. You did? That's fantastic. Warehouse work, nothing fancy. Moving boxes, managing inventory, but it's steady. 40 hours a week with benefits. Benefits, Noah. Health insurance, paid sick days, the whole thing. I start next week. I'm so proud of you, Marcus. And I saw Emily. Last weekend. I sat down, needing to be grounded for whatever came next. You did? How was it? It was... His voice cracked with emotion. It was hard, and beautiful, and terrifying. We met at this office with a social worker, and when Emily walked in, God, Noah, she's so grown up. Taller than I remembered. She looks like her mom, but with my eyes. What did you talk about? Everything. Nothing. I apologized for leaving, for not being there. She asked questions, where I'd been living, why I couldn't visit, if I was okay now. I was honest with her. Told her about being homeless, about the accident with the blade, about the program helping me rebuild. I didn't hide anything. How did she react? She cried. I cried. We both cried a lot. He laughed, a sound of pure relief and joy. But at the end, she hugged me, just wrapped her arms around me and held on tight, and she said, I'm glad you're back, Dad. I'm glad you're back. Those words, I don't have words to describe what they meant. I felt my own eyes burning with tears. That's beautiful, Marcus. That's everything. I know. I know it doesn't fix 6 years of absence. I know I have so much work to do to earn back her trust, to prove I'm reliable now. But it's a start, a real start. You're doing it. You're actually doing it. Because you believed in me when I didn't believe in myself. Because you fought for me when it would have been easier to just treat my throat and move on. You saved my life, Noah. Not just from the blade, but from giving up. You saved yourself. You did the hard work. We both did. We talked for a few more minutes about his new job, his growing relationship with Emily, the small daily victories of having a stable life. When we hung up, I sat in my car in the hospital parking lot, the phone still in my hand, overwhelmed by emotion. Rain was falling again, that soft, persistent rain that seemed to define this city. But inside the car, I was warm, whole. I thought about all the patients I'd see tomorrow, all the cases that would come through those emergency bay doors. Some would be straightforward, others would break my heart. And a few, just a few, would remind me why I chose this impossible, beautiful, devastating profession. Because sometimes, against all odds, you get to witness a miracle. Not the kind in medical journals or the kind that makes headlines, but the quiet kind. The kind where a man who'd lost everything finds his way back. where a daughter gets to see her father again, where hope survives despite the system trying to crush it. I started the car and drove home through the rain. And somewhere in the city, Marcus Webb was living proof that compassion, combined with action, could change a life. Dr. Keller had been right. You can't save everyone. The system is broken, and one doctor can't fix it. But you can save someone. You can see people when others look away. You can fight for the ones everyone else has given up on. And sometimes one person is enough. Sometimes one person is everything.